really a pleasure to be here, and thanks to the wonderful arrangements by the Bhopal Society and a wonderful, wonderful IMSCON. I'm going to take you somewhere else now. Why do we really age? Why is Anju Soni not aging as fast as all of us are aging? There is a lot which needs to be really understood. And a lot of people say, age is just a number. I don't really think so. Of course, I may agree to a certain extent, but we are all programmed to be aging. And that is something which we have to understand really, because this is a huge, very, very different science which is there. Now, yesterday, if you had gone to the exhibition, there's a machine there which reads your face, the skin changes, and actually tells you what your chronological age is and what your biological age is. And that's something which probably is what we are defying, because chronologically is the number of years we live. But biological is actually what you really reflect. So I may be like 50 years old, but I look like 65 years old. That's because of the lot of factors, from the genetics to the environment, to the diet, to the lifestyle, which have contributed to it. And maybe I haven't really cared as well. I will tell you something else a little later. Now, as we go ahead, let's understand why we age. There are hundreds of factors which are there, which probably a few of them are more contributory. And the telomere length with which we are born and how we degrade it is another one. And genomic instability, because of the epigenetic changes and all, there's lots which I probably can't go into the details. But this is something which telomere, which is a biomarker for our aging, and that really needs to be understood. And if you really want to know how you have aged and how much you will probably live, and if you want to start rectifying, this biomarker is a good one, which will let you know on that time starts now. Now, oxidative stress we are feeling every day. And this oxidative stress is bringing in cellular damage. And this cellular damage is actually bringing about aging because of the damage it is doing to the degradation, which is doing to the telomeres. Now, our bodies are really smart. We have the damage, but we keep on repairing also in all age groups. But wherever the repair slows down, that is where the acceleration in the aging actually comes. And when does the repair slow down? When the inflammation is much more. And all of us are exposed to a lot of chronic inflammation. If you'll do your CRP levels, you'll know how much elevation is there. If the cytokines, and especially the pro-inflammatory cytokines, will actually let you know. So my $100 question is that, can we really defy biological aging? And how do we do it? A lot of us are looking for that fountain of youth. I would really want to take a bath in this fountain and come back as a 16-year-old, but I don't think it exists anywhere. So then we succumb to a lot of functional reversing. Now, some of these are really good, but some of them, the cosmetic ones and all, you could probably, change the way you look. You can change your knees and start walking well, but even after that, you have to exercise for the sarcopenia not to set in, because even with those changed knees, you'll not be able to walk if the muscles are not good. So functional reversing is also has to be really nicely thought over. But did anyone pay a little heed and say that most of our problems start from perimenopause and then go ahead into, the sufferings continue till as we advance in age? And a lot of research has not connected these dots. And that's a very, very important aspect which we must know. Now, we used to be, I hope it's not true now, hysterectomy capital of the world, because we used to do so many hysterectomies, and we'd never realized that a woman, if she goes through a hysterectomy early in life, it's not only that she's losing her uterus, she's losing a lot of other things also, and especially aging. The cellular aging is something which is really, really accelerated because of that. And to the tune that every 8 years after that, she adds 1 year into her biological age. Now, that is something which we have to understand, and we know a lot of women who have undergone hysterectomies even at 28, 29, and so on. And what has been understood is that women who have been put on MHT, their cellular age is lesser, younger. So again, when you start MHT and the other things are really important. Now, can we defy age? And when should we really start? Now, as I said, aging is inevitable. There's nothing we can do about it because it's very well defined by what we have actually inherited and how we have really looked after ourselves in the beginning. But I'd like to try and make you understand in a different way. Now, why did my grandmother live for 96 years old? And till 96 years, she was washing her own clothes and doing her own chores. Now, it's really important for us to understand why some individuals live longer and healthier than the others. Now, there's a lot to do with our microbiome. Now, what we inherit much more than our genes. So let's understand in a different way. Like people who are living longer, we did a microbiome testing for them. Now, the kind of bacteria, viruses, or fungi which were there in their gut was totally different from the unhealthy or the biological aged individuals. So there is something, another part of it, or a missing dot, which probably we haven't connected apart from the other things which we have understood in this organization. And that's something which we now need to focus on, because this is now a whole new science of microbiome. Our gut bacteria produce a lot of enzymes which we humans actually lack. And for fermentation and the breakdown of the complex carbohydrates which are there. And these microbiome actually produce those, and they help us digest a lot of things. In the process of digestion, they produce short-chain fatty acids, again, which are very, very important for a lot of the functions of our body, especially our immunity, especially a lot of changes in our metabolism and even reproduction. So these short-chain fatty acids produced by the gut bacteria are really, really important for the several reproductive and immunological functions. So there is a lot of crosstalk which is happening between the gut bacteria and our bodies, which are important. And I don't think we have ever connected this, and I would really like all of you to connect, because if there is a good balance of the good bacteria in our bodies, the gut is, the lining or the epithelium is maintained. But the moment dysbiosis happens, our gut becomes leaky, all the endotoxins are actually getting into our bodies, and then the pro-inflammatory responses are being produced, and those are the ones, all the diseases which we have at a later age are because of inflammation, or what we normally call as inflammaging. And that is something which we have to understand, because whether it is the chronic diseases like diabetes, cardiovascular, neurodegeneration, and all those, or if they are immunological, they are all because of the inflammaging which happens because of this lack of or the break in the gut barrier integrity. So we really have to understand. Now, we humans have a unique microbial signature. Now, what is that signature? If I am born, if my mother delivered me vaginally, what am I going to inherit? I'm going to inherit the lactobacilli which is there in her vagina. So there's a huge difference in what we inherit if we are born through a vaginal birth or through a cesarean section. So if you're really delivered by a cesarean section, what are you going to inherit? The staphylococci which are there on the skin. Even the father's microbiome also has an effect, because, and our microbiome develops right from in utero to the first 2-3 years of our life, mostly, and it stabilizes by mid-adulthood. So what is happening here now, after the vaginal birth or a cesarean section birth, how the breastfeeding has been continued or no. If there's no breastfeeding, then the microbiome is going to be different. When you're weaning the child, what is the child exposed to? If you're exposed to a lot of disinfectants and all those things which we are now, using, especially even the cosmetics which we are using, the sprays which we are using, it kills a lot of the bacteria and the viruses which are there in our bodies, which are good ones, because there has to be a balance between the two. So without realizing also, we are doing so much damage to our next generation. So this distinct microbial inheritance is really, really very, very important. And there's a huge difference between breastfed children and the formula-fed children. There's a huge difference in the exposure as far as the early childhood is concerned. And this lays the foundation of whenever this ratio actually between the good and the bad bacteria, I'm just putting it simply, is disturbed, why we are obese, why we have more non-communicable diseases. And if the other ratio is disturbed, we'll have irritable bowel syndrome, because obviously the leaky gut is really going to give a lot of other issues. And another very important aspect is that we need to have a diversity of microbiome. So we need to have as many good, I would say, genuses of the various microbacterium and the fungi in our body as much possible. Because if you have a good diversity, then it's much, much more healthier. But that diversity has to be maintained between the lactobacilli and some of the good bacteria than the others. Because the moment this diversity goes down, especially when we are aging, your dietary patterns change, your lifestyle changes, your exposure to a lot of other things changes, and your fiber content in your diet changes. And fiber is really very important. So if you have seen that Good Bug ka ad, it has a good bug and it's got a prebiotic, which is the fiber, which is really necessary for it to digest. So all those then can have a lot of symptoms as far as Alzheimer's, dementia, and other things are concerned. And yes, there is a difference between the microbiome of men and women. And that's where the metabolic effects, and when me and Naren go for a detox session, in 7 days without eating, I'll lose only about 3 or 3.5 kilos, and he eats everything and he loses 5 kilos. That is the difference between the men and women which are there. Now, the age-related deterioration, as I said, again, because of various factors of our aging, that happens. Yesterday, we were discussing this about how gut microbiota is actually also responsible for a neurodegeneration, the cognitive degeneration which actually happens. And this blood-brain barrier disruption because of the gut microbiome is a very, very important factor. So can you imagine that your diet also, or the way you were born, or the way you have inherited, the way you have brought up your children is actually going to have an effect, or how you deliver your patients. Today, it might just change, that we might, hopefully, understanding this, revert back to doing a little extra effort in delivering them vaginally, which is a very, very important aspect, which I would say. So what are the key changes in the gut microbiome which will lead to aging? So there is a reduced microbial diversity. There's a decrease in the beneficial bacteria. There are increased pro-inflammatory microbes which are there, and there is a lack of or a reduction in the short-chain fatty acid producing bacteria, and of course your lifestyle and the medications which you take can also have an effect. So this is now a huge precision medicine which is coming up. I can't really explain further than this, but we can study your microbiome and then devise a treatment protocol in balancing all those so that we have a much, much better outcome in the times to come. So is it really possible to manipulate the gut? As I said, by the time you reach young adulthood, the microbiome somewhat gets stabilized and it becomes very, very difficult to change. Of course, you can change it a little. It will take much longer time, but it may not have the same effects as if we have really grown up with a healthy microbiome. So we could probably restore a little, but it's not really going to have as good an effect as in the times to come. So what can we really do? Of course, lifestyle choices beyond diet. A regular exercise is very, very important. We are looking at exercise in a different way. I am looking at it in a very different way because it is going to give you a biodiversity of the microbiome, stress management techniques, and a quality sleep, which we have been already talking about. And a lot of antioxidants and anti-inflammatories agents are available. A lot of people are taking it. But if you just include vitamin C, loads of vitamin C in your diet, it's really going to help. If you include a lot of omega-3 fatty acid, it's really definitely going to help. Some people can look at anti-aging drugs which are there. Metformin is one of the latest in the edition. Yesterday we talked about statins. I don't have time for this. Probiotics. Now, if I give you probiotics, a combination of probiotics in the right dose, which is important, about 10 billion of them, colony-forming units, it can really make a little difference, which is important. But if you can't do all that, there are many other things which are available, like apart from the pro and the prebiotics, short-chain fatty acid supplementation, diet modification, and we have now fecal microbiota transplants, which are being done for diabetics a lot today. Yoga meditation to reduce your stress and cardiovascular exercises. Of course, we have MHT as a little part of it for the other kinds of health, but not as much as far as biological aging is concerned. If you start at the right time, the cellular damage is much lesser. So that is something which we should be looking into. And regenerative and genetic engineering, I don't have time, sorry for this. I thought my talk was for 20 minutes. Now, last slide is that today we have artificial intelligence. We have precision medicine. So we can probably tomorrow look at personalized prescription for each one. Pushpa was asking me about the golden vial. This is what we do with precision medicine. We study your body, and then we make a portion of exosomes and other supplements, and that golden vial can rejuvenate a lot. So, ladies and gentlemen, age is an issue of mind over matter. If you don't mind, it really doesn't matter. But there is definitely a fountain of youth, and this fountain of youth which we are surfing, all over, actually is your mind, your talents, and the creativity which you bring in your life, and the lives of the people you touch and you love. So when you learn to tap this source, you have actually truly defeated age. Thank you so much for having me here. Thank you.